Hey everybody, it's Dr. T. Wanted to welcome you all to Confessions of a Male Gynecologist. I am America's Holistic Gynecologist, Dr. Shawn Tassone, coming to you from Austin, Texas, where I usually talk about women's health, hormones, based on my book, The Hormone Balance Bible, that you can get on Amazon. It's 500 pages of the 12 most common hormone imbalances in women with my 6-step protocol called the Shines Protocol, which uses spiritual practices, hormones, infoceuticals, nutrition, exercise, and proper supplementation to help with the top 12 most common hormone imbalances. So, by my title, America's Holistic Gynecologist, I feel like I have one foot in the allopathic realm, MD trained, but I also feel like I have one foot in the alternative channel because I did the board certification in integrative medicine, where I spent 2 years at the University of Arizona, and did a fellowship on learning more about alternative therapies. And if you listen to my podcast from last week, I talk about what I feel is the scammy functional medicine aspects of medicine, where there's a lot of test ordering, there's a lot of meaningless supplements and tests, and kind of milking the American public out of their hard-earned dollars by so-called gurus and people that really have absolutely no training in medicine. And the reason that I bring that up is because I'm going to be talking today about Trump's nomination of Casey Means, and kind of try to stay in the middle of the road with this. I don't want to get too political about the nomination, but I want to look at who she is and what she is and some of the questions that I have about her nomination. Now, overall, and the overriding theme here is that the Surgeon General, while it's obviously an honor to be nominated and it's really cool, and it's a great position, it isn't necessarily a particularly powerful post. I mean, the Surgeon General is a part of Health and Human Services. The Surgeon General reports to the Assistant Secretary of Health and Human Services, who then reports to current head of Health and Human Services, who is Robert Kennedy. And it makes sense to me that the nomination came because the first person that Trump nominated, no shade being thrown here, but she was a graduate of a Caribbean medical school. And in my opinion, people that go to Caribbean medical schools go there because they couldn't actually get into an MD program, because nobody's going to openly say they want to go to a Caribbean medical school unless they didn't get into a medical school here. Those grads also have a tougher time getting jobs here, because the standard is just a little bit lower. And so I think her nomination was pulled because she just didn't have necessarily the credentials that Trump was looking for. And then he probably went to Bobby Kennedy and was getting recommendations. And Casey and Callie Means have been in that circle with Bobby for a while. They've been working with him long before this nomination. But I wanted to kind of talk about Casey Means. I don't think people know much about her. If they do, it's the part of her that is sort of pandering a little bit. I want to go into her story a little bit. I want to talk about, who she is and what she's done, kind of keeping it in the mindset that the backdrop being that, even if she gets the nomination, what she stands for or at least what she says openly, and what she stands for is basically better nutrition, getting processed foods out of, schools and things like that. And all that's great. I mean, that's something that we obviously need. I think that it's something that could be extremely helpful, but there's just I'm going to do this story based more on interest. And I think, not that I would vote against her or for her if I was in Congress, which, the Surgeon General is one of those posts where you get nominated by the president, then you have to be confirmed by the Senate, I believe. So she's going to have to go up and answer some questions. And I just wanted to be a current give you current events and current topics. So let's dive into who she is. Casey Means is a medical doctor. This is coming from her directly. Obviously, she describes herself as a medical doctor, New York Times bestselling author, tech entrepreneur, aspiring regenerative gardener, and outdoor enthusiast who lives in a state of awe for the miracle and mystery of existence and consciousness. Okay. During my training as a surgeon, I saw how broken and exploitative the healthcare system is, and I left to focus on how to keep people out of the operating room. Okay. I am passionate about working towards a healthier and happier planet by empowering people to understand their health and limited potential within them. Now, she got her bachelor's of arts at Stanford undergrad. She went to Stanford Medical School, and by all accounts, she was at the top of her class when she graduated from medical school. She then went into a highly coveted residency program in ears, nose, and throat, otorhinolaryngology, which in my day and even now is a very competitive specialty. So she obviously had the medical training, the grades, the chops to get into a highly coveted field. More, good for her. That's actually, outstanding. And then she describes in her story about how she kind of got disillusioned in her 5th year of residency, and that she just walked into the dean's office and quit. Now, I want to break that down because she uses that as a leverage point to show you that she's a great person, because she was so frustrated by the system that she was willing to go to 4 years of medical school, 5 years of a really rigorous residency program, and then she was just going to give that all up because she was that disillusioned. Now, here's the thing. When you go to medical school, especially a school like Stanford, I mean, it's not cheap. You're probably looking at $250 or more $1,000 for that complete education. And then you go into a residency program and you don't get paid very much. Most residents probably make about $60,000 a year. And it's enough to live on and live, nicely. But you really don't even have money to pay back your loans yet. So those loans keep accruing interest. I don't know if she was rich and if she got money from her family or if she had to take out loans like some of us did. I joined the military. They paid for my medical school, but my son just graduated from medical school and he's got like $400,000 in loans. So it's a big burden to just then turn around and quit because you're disillusioned. Doesn't sit right with me. It doesn't make any sense. And the residents that have been with her, that were with her in that training program, have come out recently and said she never talked about this disillusionment. She never acted like she was frustrated or had issues with the system. So I kind of feel like if I'm staying kind of as not a skeptic, but I'm just going to question everything, it seems to me a little bit out of place. Like, it doesn't make sense to me that you would quit after all that time. Now, what I could see happening is what happens to many of us in medicine is we go out, we practice a while, maybe 2-3 years, we become really disillusioned because we don't like the schedule, we don't like the money, the insurance deals, all this stuff that just gets super frustrating with running a practice. And then you try to change the way that you practice, you alter the way that you practice, which is kind of like what I did. What I did was very similar to what most doctors do. You become disillusioned with the system and you start looking outside of yourself. You start growing, you start taking more courses, you start doing all the things that are necessary. To me, I don't know. It seems somewhat disingenuous to say that you just quit and that you were going to become this crusader for health. Now, I'm not saying that that's not the reason. It's just something that I question because it makes absolutely no sense to me that you would literally throw away 9 years of your life because you were disillusioned. We all become disillusioned in things that we do. My son works for Charles Schwab, and he thought it was going to be this dream job, and he became disillusioned. Everybody's disillusioned at one point or another, but to throw away 9 years of an advanced education, and you were literally months away from graduation, and you then throw it all away with absolutely nothing to show for it, is bothersome to me. And I think, the other thing is, then when she hit the scene about a year ago with Vani Hari and Mark Hyman and Josh Axe and all these other grifters, um, when she showed up on the steps of the Capitol and says she didn't learn any nutritional education in medical school, is a basic lie. I mean, I'm sorry, it is. You may not learn it to the depth that a nutrition person learns it, but you do learn some nutrition. We all learn nutrition. You learn it in biochem, and you learn it in, life in general. I mean, there is education. Maybe some people would argue with me and say, no, you don't, but they're wrong. Unless you've actually been to medical school, it's not like a ton of information, but you do get some. To say that there was absolutely no education is a total lie. But then what she did that was interesting is she went to the Institute of Functional Medicine, and she didn't get board certified in functional medicine. She took a course. And I do have in my last week's podcast, I talk about the Institute of Functional Medicine and how it started and everything like that. So I would encourage you to go back and listen to that if you're interested in learning more about that. And then she became what she calls an investor and an advisor or investor in different companies. She co-founded something called Levels. Levels is a company she founded that uses continuous glucose monitors to show people what their sugar levels are. Now, I'm sorry, I don't buy into all the continuous glucose monitoring stuff. I think it's a money grab. To know, it's basically something that you are pandering to the functional medicine people who want to walk around downtown Austin with the little patch on their arm to show you that they're doing their continuous glucose monitoring. There's a lot of folks on Instagram that do it, and they'll eat something and they'll show you their glucose levels. For most people that aren't diabetic, it's a completely worthless thing. It's biofeedback. It tells you maybe some people who are super intelligent and super driven, and they want to know what raises their blood sugar, but there's really no science behind it. It's completely made up, and it's a money grab, and she's making millions off of that. Then she also is a part of Functional Health with Mark Hyman, which I think is a total scam. Functional Health is a company where you pay them $500 and they order you about 100 worthless tests of about, maybe you only might need 6 of them. And they give you an AI generated report that is basically not individualized. It's if your lab comes back in the range of yellow or red, it just gives you a report. So now you have this $500 lab test, and you have an AI report that basically gives you nothing, and there's no doctor follow-up. So it's a total money grab. Again, for people that have unlimited means and they have unlimited time, and they want to know more about their lives, and sure, it's fine. It's like doing one of those MRI scans as a preventative technique. If you have the money and you want to do it, sure, go ahead, have fun. But it's not something you need to do. It's not something that's endorsed by any medical guidelines. And then she also is an investor advisor in a company called TrueMed, which I think is owned by her brother and her. It's a website that teaches you how to spend your money from your HSA and your FSA, sponsored by Armra, which is a garbage colostrum company, cold plunge companies, which are completely not necessary. So you can see where I'm going with this. They have money. They're smart people. They have invested a lot of money. And what's funny is she harps on her medical training. She talks about how horrible the training was and how horrible the medical system is. And here's my problem with that. I hate it when physicians do this. I hate it when they they have this light bulb go off, which a lot of us do, but then they turn around and they demonize the medical system that trained them. I'm telling you right now, nobody would be listening to this person if she wasn't an MD. So she loves to brag about the fact that she's Stanford trained and that she went to Stanford and she did great there, but then she bashes the same system. The MD is what gave you the platform. So don't then go turn around and bash it. It's called pandering. You're pandering for likes, you're pandering for comments. You are attacking the medical system because it's easy to do. I think it would show that you had some guts if you actually defended your medical degree and tried to balance the medical degree that you have with the gaslighting that goes on. I just think it's pandering, and I personally have a problem with that. So she wrote a book called Good Energy, which is, I believe, a nutrition book. I didn't read it. I'll be perfectly honest. It's not something that I'm interested in, but it talks about metabolic health. And obviously, since she's gotten so popular, she's sold millions of copies. And, I think it's got good reviews on Amazon overall. As she's a public figure, there's going to be people that are detracting from it and whatnot. But more power to her. I think whenever you write a book, that's great. But she seems to do a lot of things with her brother Callie. It's almost like they never do anything separate from each other. But anyways, you can see the background here. She's a little bit, I would say, sketchy in the sense that she does what all the other functional medicine doctors do. She's kind of an expert in a field that she really wasn't trained in. So she's saying that she got no nutritional advice in medical school, but now she's a nutrition expert. And she's saying that when she came out and then she quit medicine, she still used her MD. So she wasn't so disillusioned that she didn't use her MD to make a lot of money, like I talked to you about with this company Levels with the CGM, the continuous glucose monitors. She's got a website on how to use HSAs, and because her and her brother are doctors, which she was bashing, now all of a sudden it's okay to be a doctor. So I think I don't know. It's a little bit disturbing to me that you bash the system and then you turn around and make money off the fact that you're an MD. I think it's a little bit disingenuous. And that's kind of where I keep coming back to, is it just seems disingenuous. But what person in that position in the public sector probably isn't a little bit disingenuous from time to time? If you look at some of the statements that she has made online and that she has actually posted on X. I've got a few of them that I want to kind of talk about. She said, and these are quotes, I did not learn that for each additional serving of ultra processed food we eat, early mortality increases by 18%. Now, keep in mind when these people talk about stuff like this, they don't ever provide any data. Okay. So this is just a comment. I don't know where she got the 18%, but what that would mean is for each additional serving of ultra processed food you eat, your mortality increases by 18%. So if I ate 100 bags of chips, then this means that my mortality risk has increased by 1,800%. And that doesn't even make any sense. So I don't think that that's a true statement. It seems highly unlikely. Again, no evidence was provided. She said, I certainly did not learn that medical error and medications are the third leading cause of death. She's saying she didn't learn that in the medical school training because her medical school training was so horrible. But it's not the third leading cause of death. So this is a lie. The third leading cause of death in the United States is accidents, and the majority of accidents are car accidents and falls. Medical errors are a real cause of distress and concern, but they are not the third leading cause of death in the United States. So we have a little bit of an issue with some of the statements so far. I didn't learn that 95% of the people who created the recent USDA food guidelines for America had significant conflicts of interest with the food industry. Now, first of all, before I dissect that, she's also doing the same thing. So she's selling continuous glucose monitors. She's telling people how to spend money in their HSAs. Is she being completely transparent that she's making money off of all that stuff that she's doing? Um, I think it's the pot calling the kettle black, but nobody gets sick following the USDA guidelines. If you follow it's not perfect, but if you follow the USDA guidelines, which are to eat around 2,000 calories a day, focus on nutrient dense food, limit sugar sweetened beverages, this is an entire nutrition grift that she's doing. The guidelines are solid. I mean, they're not great, but they're solid. And if you followed them, you probably wouldn't be morbidly obese. Obviously, there's room, there's error in there and whatnot. But to bash the USDA guidelines is a little bit. It's just too easy, and it doesn't make sense. I didn't learn that professional organizations that we get out of practice, like the American Diabetes Association, the American Academy of Pediatrics, have taken tens of millions of dollars from Coke, Cadbury, processed food companies, and vaccines like Moderna. So this is why the scientific community requires conflict of interest statements, which is what we just talked about. Unlike her in her current work, because she's selling the glucose monitoring companies to healthy people and telling them to stress out and obsess over their blood sugars. So she's not telling people that she's making money and she has a conflict of interest, but she's then turning around bashing. It's easy. See, this is the thing. It's a low-hanging fruit to bash medicine. It's low-hanging fruit to bash vaccines and big pharma. Now, I'm not saying that any of that is right or wrong, and I do think big pharma needs to be bashed. Don't get me wrong. And I do think that the vaccine thing that came out was horrendous. But you have to look at it like you're saying this, you're promoting this, and yet you're doing the same thing. I didn't learn that just 5 nights of sleep deprivation can induce full-blown diabetes, pre-diabetes. Well, first of all, that's totally wrong. That's not even true, remotely true. But running a marathon can induce full-blown kidney disease. But it doesn't mean that you shouldn't run marathons. It's this kind of like you take this little nugget of truth and you use it to fearmonger people. She says, I didn't learn that if you address these root causes that all lead to metabolic dysfunction and help patients change their food and lifestyle patterns, we could reverse chronic disease crisis in America, save millions of lives and trillions of dollars in healthcare costs. Well, this surprises me because I learned this in medical school. I think we can all learn it online. So why she didn't know it, I don't know. But when people use this root cause phraseology, you know that there's something here going on. Root cause is a it's a marketing term, in my opinion. Probably meant something 15 years ago when functional medicine started, but it's one of those things where when they use it now, it's usually used as a smokescreen to maybe draw you in, to make you feel like this person cares. And when they say things like what your doctor didn't tell you, I've talked about this before. These are the same people. They use these words. It's a marketing term. So Trump has nominated Casey Means. We know she's Stanford educated. She turned wellness influencer and entrepreneur. Well, kudos to her. None of that stuff is particularly hard. And this was after Jeanette Nizawat, who was nominated before her, was facing bipartisan scrutiny over her credentials. So Casey Means wasn't the first choice. She has these MAHA credentials, and that's kind of what we're dealing with right now. Kennedy wants to do things a certain way, more power to him. But I don't even think Trump knows who she is, to be perfectly honest. As a matter of fact, I think he came out and said he didn't know who she was. But Bobby Kennedy recommended her, so Trump said, sure, because that's how the process works. Her nomination reflects kind of an ideological shift. And it's because of the Make America Healthy Again, which is what got him elected. So it makes sense that he would nominate somebody that wants to do that. She's 37 years old, I believe. And like I talked about, she went to the Oregon Health and Sciences University for her residency that she didn't finish. And her current medical license is inactive, according to Oregon Medical Board. So here's the other thing that I think a lot of doctors might have some conflict with. She has never treated a patient. She did in her residency, but she's never had a practice in medicine. So she's never really taken on the struggles that we all deal with in medicine. Now she's perfectly adept at talking about health and wellness and all that stuff because she's, obviously educated and smart. But she's never really been a doctor. She hasn't really put herself to the test. And if you're just going to leave when the going gets tough or when you get disillusioned, what the hell is she going to do as Surgeon General when every day you're going to be disillusioned by the system? So, anyways, in the years since she left residency, she built a pretty big following in functional medicine. As I said, she co founded Levels Health, which is a tech company that uses these garbagey glucose monitors. And then basically, she wrote that book, Good Energy, in 2024. And she makes a lot of, comments that people really resonate with. Using those kind of terms where it's one of those things where you also have to look at the person. I don't know her. I've never met her. I know absolutely nothing about her. I would assume she's a good person and that she has well-meaning intentions. Um, I just wanted to go on record and give you a little history of the person. But then, you wind all that up. She's perfectly an acceptable nomination. She's a doctor. There have been some surgeon generals that aren't even doctors, they are nurses. So you don't have to be a physician to have this post. I think it makes sense to have a physician in the post. Um, we've had a couple of good ones. Richard Carmona was a good one. He was an actual surgeon. C. Everett Koop was great in the 80s. Another, really powerful physician who really changed some things. Um, I I worry a little bit about her having the background. I worry a little bit about her getting kind of criticized for her views on functional medicine. It could go the other way, though. She could bring functional medicine to the forefront. She could bring, I think that this company, Functional Health, that she's invested in or a part of is bad. I'm not a big fan of that. I'm not a big fan of the glucose monitors, but I'm willing to give her the benefit of the doubt and see what she does. Keeping in mind that the Surgeon General's position isn't particularly influential. As I've said, probably two of the bigger surgeon generals were Carmona and Koop. They did set some policy back in the day with smoking, secondhand smoke, and some of the other stuff. And so maybe she'll be that person. Maybe she will be a champion for MAHA and for getting processed foods out of school systems. And, the problem is this too, and I'll probably get criticized for this. The whole concept of some of these things like seed oils, there's no studies that show seed oils are bad for you. This is completely made up by these very same people, and it makes absolutely no sense. How you process the seed oil might make it a little bit more volatile or toxic, but the actual seed oil itself actually has been shown to be healthy in many cases. And this is just something that's talked about by these carnivore people and people that really don't have medical degrees. I think Kennedy talks about it. There was a video of him taking methylene blue on a plane, and whatever, to each his own. But these are not things that should be promoted by the Surgeon General's office. I think, these are, if you want to set broad ranging policies like changing the food pyramid or looking at how processed foods are in the school supplies and, dyes and carcinogens, that's great. But pushing obscure medical thoughts like using nicotine for astrocytomas, and I don't think they should get into that piece. I also don't think she should benefit financially. She's currently getting $30,000 to $50,000 a speaking gig, so she's doing all right for herself. And to each their own. Like I said, I mean, I'm happy for her that she's gotten that. I just wanted to give everybody a little bit of a flavor for who this person is. the Surgeon General, it's not a highly influential thing. They report back to the Assistant Secretary of HHS, who then reports back to Kennedy, who's the current Secretary of HHS. So it's more of a figurehead position, in my opinion. It fits the Trump second term. I think it makes sense that he nominated her. Jury's out for me. I don't, particularly feel super positive. I'm not super negative about it. But I do think there were probably more qualified people. But again, let's see what she has to do. And so I'll wind it up there. I would encourage you all to go back, maybe listen to last week's episode, because I did talk a lot about functional medicine and how I think it's a little bit scammy. Started with great intentions and then obviously got corrupted by money, which things tend to do. Again, I'm Shawn Tassone, America's Holistic Gynecologist. If you want to follow me on Instagram, Shawn Tassone MD, I have a YouTube channel where I post stuff every day. I do Instagram lives a couple times a week. I do question and answer sessions on Saturdays on Instagram. My book, The Hormone Balance Bible, you can get on Amazon. I think it's a great reference book for any woman that's in perimenopause, menopause. Even younger women could benefit from it as well, just learning more about hormones and testing. And I would like for you to ask questions, be more involved, be an educated and informed consumer. And I hope you have a great weekend. I'll see you on the other side.